Hey everyone. With PCOS, we know that the risk of anxiety and depression is much higher. And the question is why? So, over the years, we've seen different studies looking at, giving information that with different answers, different hypotheses. And over the last few years, we've seen this in a very specific trend. And there was a very new research paper published this year that looked at, what are the actual key mechanisms through which having PCOS actually increases the risk of developing a mental health disorder or a mood disorder, such as depression and or anxiety. And it's very interesting, to talk about this because we're looking at things beyond just hormones and beyond just estrogen and progesterone and prolactin. We're starting to see a trend where there are increased levels of other biomarkers in the blood for patients with PCOS, and we're seeing a connection on how those biomarkers can actually affect the production of certain neurotransmitters and affect mood as a consequence. So it's important to mention, first of all, that this increase in these biomarkers seems to be present in patients with PCOS all across the spectrum. So, regardless of a patient's weight, BMI, we're seeing that patients with PCOS consistently seem to have increased levels or biomarkers of inflammation, particularly one known as TNF alpha and another one known as interleukin 6. For short, we use TNFA or IL-6, and increased levels of both of these biomarkers seems to have an impact not only on insulin sensitivity and blood sugar control, which, if you've been watching a lot of our videos over the last couple of months, we've been talking about the role of insulin sensitivity and blood sugar control as a key component for successfully having patients with PCOS conceive and get pregnant when they're dealing with infertility. But it seems to also impact the levels of glutamate. And glutamate in the brain affects mood. And so we see elevated levels of glutamate are actually associated with higher chances of developing symptoms of depression. And they usually measure depression using the Beck depression inventory. So it's a verified and well-studied form of translating a score on a specific test to how mild, moderate, or severe the level of depression is. And we see that the higher the level of glutamate, usually we see higher risk of seeing worse depressions or depressive symptoms. And so we're seeing this change just from an increase in the production of TNF alpha. So they're establishing in this latest study a connection between how this increase in this very specific biomarker actually increases the production of a neurotransmitter, which has been shown to potentially worsen symptoms of depression. And it's also very important to mention that among treating depression, it's not just about inflammation. We're obviously looking at collaborative and integrative and conventional treatments to support mood. It's not just about like we're doing one thing and that's it, and therefore no one should be taking any medication or anything. We are looking at what can we also recommend to patients to support their treatment of mood disorders, or patients who are having very early signs and the doctor or healthcare provider has not recommended any conventional treatments because it's not severe enough, but they want to be proactive. Or if they're already taking medication, what are some safe conjunctive and adjunctive treatments we can give to the patient to support their recovery, so support a healthy mood and balance. And part of that, this new research is very exciting because we're looking at the role of reducing inflammation and reducing things like TNF alpha and interleukin 6 to help support mood as well. And another important transmitter we look at is something called a brain-derived neurotrophic factor. And what we're also seeing in this new research is that as these inflammatory cytokines or biomarkers go up, we actually see decline in the brain-derived neurotrophic factor as well. And this is also a reason on why patients with PCOS are more predisposed to mood disorders. A decrease in BDNF, for short, we call it BDNF, seems to also be correlated to an increase in risk of depression. So with these increasing inflammatory cytokines in the blood that we see in patients with all forms or different types of PCOS, we consistently see that they seem to have elevated levels of glutamate and lower levels of BDNF, and how both of those translate to potentially increased risk of depression. So if this is something, if you're dealing with polycystic ovarian syndrome, if you're having symptoms of mood disorders, it's always important to seek out help, support from a licensed healthcare provider, speak to your family doctor, and also speak with your naturopathic doctor on what other treatments can support mood and support and are safe to take, in an conjunction with conventional treatments if you are using them or considering to use them. And it's important to mention that there's, research even looking at things like curcumin. It was a systematic review and meta-analysis published a couple of years back that looked at curcumin and how its role in just reducing a lot of these inflammatory cytokines seems to improve symptoms of depression for a lot of patients dealing with depression. Now, this particular paper that looked at curcumin was not looking at PCOS patients, so it was looking at patients that had depression as an independent disease apart from PCOS. And just taking one simple treatment like that seemed to improve the depressive symptoms. It seemed to reduce the risk of relapse. So it's very important looking at simple therapies that can also support your mood and recovery, and also lifestyle and dietary changes. So if you have any questions, as always, you're always welcome to send us a message or leave a comment.